biggest entertainment stories from around the world.
Hi, everybody, and welcome to Entertainment Tonight. I'm Chris Jacobs. Nancy O'Dell is on assignment. Robin Roberts is resting tonight after her bone marrow transplant. Sources tell ET she is facing weeks of isolation as she no doubt struggles to regain her strength. She has had visits from some of her GMA friends in her New York hospital room. And tonight, ET's medical correspondent paints a picture of Robin's critical next steps as she sends a heartfelt message to her fans just hours before the surgery to save her life.
You gotta change the way you think in order to change the way you feel. Let me just say this lastly. I feel the love, and I thank you for it. Thank you.
The 51-year-old hopeful and in high spirits, though she looks a bit worn out and thinner than she did barely 22 days ago, her last day on GMA.
She feels crummy. Her mouth hurts. She's got a headache that won't quit.
Robin was likely awake for her procedure, the marrow transplanted through an IV.
You've killed all the bone marrow in the body, and now you're giving a foreign bone marrow.
Dr. Sonu, a surgeon at Cedars-Sinai in Los Angeles who hasn't treated Robin, explains that today needles are rarely used to pull marrow directly out of the bone. In fact, the transplant itself is relatively painless. So what's next for Robin? For the next 30 days, she'll probably be in an isolation room.
You're wiped out, you're lethargic, you have the risk of infections, you can take weeks to months to really get to the point where you're functional. A procedure like this, it's probably hundreds of thousands of dollars, but it can be life-saving.
She is such a strong and inspirational woman. Robin, we here at ET wish you the very best. Okay, now more trouble for former